Okay, my presentation is about comparing autism spectrum disorder between males and females. I want to start off with this quote that says, if you've met one individual with autism, you've met one individual with autism. So this means that each individual with autism is different and won't have the exact same patterns of behavior, specific routines, or difficulty with social communication as other individuals with autism. And it is extremely important to remember when diagnosing children with autism, or if you have children of your own and thinking that they might have it, just that it looks different between each individual. So to begin the comparison of autism between males and females, I first want to point out the statistic that for every 4 males diagnosed with ASD, only 1 female is diagnosed with autism. So you may be wondering why. First off, there's no known single cause of autism. There's still a plethora of research that needs to be done. And there are a few different possibilities for the differences between males and females. One of them being the expectation of social communication and play behaviors in children. So, for example, restricted interests around dolls or babies in females might be misinterpreted as pretend play. There's also something called diagnostic bias. Research found that males with autism are found to show more externalizing behavior problems than females, such as aggressive behavior, hyperactivity, reduced prosocial behavior, and increased repetitive or restricted behaviors and interests. Where in contrast, females with autism show greater internalizing symptoms than males, including anxiety, depression, and other emotional symptoms as reported by parents. The research went on to state that these differences raise the possibility that male typical externalizing behaviors are more disruptive in a home or school setting than the female typical internalizing behaviors, which means a greater likelihood of evaluation and diagnosis for males, especially when compared to high functioning females with autism. There's also differing symptom presentation, which are the various symptoms that males and females with autism may display. So I will go into that on the next slides. So research stated that males tend to demonstrate a higher prevalence of ADHD, attention deficit hyperactivity disorder, and they may show more behaviors that trigger a clinical evaluation, such as hyperactivity and aggression, like I stated earlier. So for females, research found that females often demonstrate less repetitive behaviors, and that those repetitive behaviors may be different. So for example, a young woman with autism carrying a few books everywhere she goes and constantly reading them to avoid social interactions may be a repetitive behavior that goes undetected. And in the future, clinicians should be encouraged to consider all the behaviors or characteristics of females as a whole and look for repetitive behaviors of any kind. Next, females tend to be underrepresented at the higher levels of the IQ distribution. So this says that females are often underrepresented in people who have a diagnosis of autism when higher IQ is taken into account. So this means that of people with higher intelligence level, females are less likely to be given a diagnosis of autism spectrum disorder. This source stated that it may be because females with higher intelligence can use their intelligence to develop coping strategies and to learn ways to navigate their life experiences despite their autism symptoms. Another point is that their females' behaviors might be more acceptable. So females are often able to display more socially acceptable or functional skills in their social interactions as compared to males. Females may also have limited interests, but these interests may appear to be acceptable by society, so they are less noticed as a symptom of autism spectrum disorder. For example, if a female's restricted interest is in a certain genre of books, it may not appear to others that this is a symptom of ASD, even when she does not have many other interests in her life, which would be a big red flag for an autism diagnosis. And this is not to say that males don't experience these examples of restrictive or repetitive behaviors, but females may experience less noticeable behaviors of this type, which may make it more difficult for them to be given an autism diagnosis. So for motor skill deficits, there was a study that examined children ages 17 to 37 months and found that females had more motor skill deficits, but less communication skill deficits compared to boys with autism. And it is important for parents to understand these differing characteristics between males and females with ASD and to get their children evaluated by a doctor or speech language pathologist if they have any suspicion that their child could have autism spectrum disorder. And my takeaway slash handout part of this presentation is a screening that I found online, and it's called the Girls Questionnaire for Autism Spectrum Conditions. So I uploaded 2 links. There's one screening for 5 to 12-year-olds and another for 13 to 19-year-olds. This is the world's first screener directed towards the female presentation of autism spectrum conditions, and it was published in the Journal of Autism and Developmental Disorders in February of 2018. Depending on the age, it asks about behaviors related to play, friendships and social situations, abilities, interests, sensory profile, and medical history. A few examples of questions on these handouts is that could be, does she apologize when she makes a social error? Are her interests advanced for her age? Are her interests immature for her age? Is she attached to certain toys or objects which she uses to calm herself? It also asks about a variety of differing interests, and if she has ever presented symptoms of depression or anxiety. And it is important to note that this is not a diagnostic tool, but it can help screen for certain behaviors that females with autism display that other screenings may not address. And these are my references.